Good morning, everyone. Can you hear me? Participant from remote.
We can hear you. Go ahead.
Okay, thank you so much, friend. Welcome to the disaster mitigation working group meeting. We have session today. Oh, sorry, we have two sessions today from 11 before and right after the lunch. In this meeting, it's so exciting that we have two new topics for this working group. The first one is about health-related hazards. I think everyone has been experienced the pandemic in the past 3 years. But as the disaster mitigation working group, we would like to see if there is anything we can do according to the working group's objectives and based on the experiences. It's very lucky that we have two experts from Philippines and also from Japan. They like to share their experience or case study about this topic. The second topic is about Earth observation. As you can imagine that in order to have a hazard risk analysis, the observation data is the most essential and is the most important first step. And making use of the satellite data has been very important to providing the hazard observation data, apart from those data collected on the ground. So we also have many experts from the Philippine Space Agency and also from the Taiwan Space Agency. They will share their achievements, experiences in the afternoon. And of course, we also have some updates from the hazard mitigation. For example, Dr. Chai will share the progress about the monitoring of the wildfire, smoke, anything related. And yeah, as the last speaker in the first session, and we have another Philippine speaker from ASTI sharing about the lightning and thunderstorm case study. So in the last, we hope we can have a few minutes about the discussion about the regional collaboration and the activities in the next APAN meeting in Thailand and also in the future. So that's the arrangement of the two sessions today. Any comment to the program? If not, the working group, we have co-chair, Vera Chai and also friends. He's now the director of the ASTI in Philippines. I'd like to invite Chai and friends to have few words, for the working group. Yes. Go first. Yeah. Friends?
Friends, just go first.
Hi, Eric. Hi, everyone.
Hello, friends.
So let me go first before Chai, if that's okay. All right. So good day to all the on-site participants in Sri Lanka. Sorry I can't be there, but Bani is there, as well as our online participants elsewhere. It is with great pleasure that we extend a warm welcome to each of you at this important disaster mitigation session in APAN 56. So as we gather here today, we recognize the importance of our collective efforts in safeguarding our communities and environment from the challenges posed by natural and even man-made disasters. This meeting serves as a platform for us to share insights, experience, and innovative ideas that will undoubtedly play a vital role in shaping effective strategies for disaster preparedness, response, and recovery. Our collaboration and dedication to this cause reflect our commitment to creating a safer and more resilient world for generations to come. So we encourage open and constructive dialogue throughout the sessions, fostering an environment where diverse perspectives contribute to a comprehensive approach to disaster mitigation. So your participation and contributions are invaluable as we work together to mitigate risks, enhance our response capabilities, and fortify our communities against unforeseen events. So just recently, we've experienced several meteorological records being broken. So it's really something else what's happening around us. Now, in today's session, we have presenters on health-related hazards, followed by Earth observation data application. So we thank all our resource speakers for sharing their valuable time with us. So let us embark this journey together, armed with knowledge, determination, and a shared vision of a safer and more secure future. So welcome once again, and let's make this meeting both productive and inspiring.
Thank you so
Thank
much,
you, Eric.
friends.
Now I pass the mic to
Very-
Chai.
Yes.
Yeah.
Well, you cover everything. Yeah, I don't have to say anything much. Just welcome to the our working group. We have been doing this for a long time, and we are trying to also later we will talk about in the second session how to get funding to move it again. So that's another thing that we will try to do, and talking about what gonna happen in Bangkok next APAN 57, but it's now getting a little bit big for our session, but we will discuss about that in the second session. And then all of your participation are needed, like Director Francis. Everything is new record almost every day. It's a flooding, very bad, hailstorm, very strong hurricane, very, very bad fires. And now, I don't know, I have to check. Indonesia is Jakarta covered by a lot of smoke now and very bad air quality. So our working group intend to try to mitigate that if possible. And through your support and collaboration, both from the online people, speaker and participant that helping us, kindly helping us, and here that you are here, we have to get together and make it better if we could. And then that might be the theme for APAN 57 as well. So welcome. Thank you.
Yeah, thank you so much for the co-chair, friends, and Chai. Because we also have several new faces here. Let me, I'll have 1 minute about the working group. As mentioned by friends and Chai, the objective of this working group is to support the capacity development for hazard risk analysis by making use of the numerical simulation or other innovative technology, and also the data through collaboration at all levels. Yeah, that's very, very important. Of course, you are all aware of the challenges because of the changing Earth, as Chai mentioned, the human resource and also the fundings. The working group is actually established about from 2014, I think. Yeah, it's been almost 10 years. Yeah, we've been conducting a lot of case studies. I'll summarize that in the second session. So the case study based approach for improved numerical simulation capability, and based on the deeper understanding means to understand the physical mechanism behind the disaster, behind the hazards. So making use of the new knowledge so that we can enhance the capability of the hazard risk analysis, enhance the accuracy and performance of the numerical simulations, yeah, etc. So we are together developing the best practice and also risk analysis. And you are very welcome to share those simulation tools or those tools you are making use to support the risk analysis. So we try to build up a open and sharing platform as well. It's luckily that we already have a open and data sharing working group in APAN, leading by Chai. So we need such best practice and also guideline to supporting this. Of course, the engagement of the local user community is still very, very essential for that. So together, we like to investigate the issues for the sustainability development goals from the partners So that's about the overall objectives and also what we like to achieve together. So without further ado, I think we should move to the program and welcome our first speaker from the St. Luke Medical Center, Dr. Marcelo. Yeah. So I'll stop sharing here and Marcelo, please share your screen.
Thank you. Good afternoon, everyone. Good afternoon, Doc Franz, Chai, Eric. Thank you for inviting me here. I'm happy to hear that you are actually already a group or of people who know each other and you are a network, because that's basically also the same message that I have for everyone. Are my slides showing correctly?
Yes, very good.
Yes.
Thank you. So I followed the title assigned to me, which is health-related hazard mitigation in the Philippines. And I think many of you have visited our country already, or at least have heard what's been happening in our archipelago. Health-related hazard mitigation, particularly in the context of the Philippines, refers to the efforts, plans, and interventions to reduce or eliminate the long-term risk to human health from hazards, especially those resulting from natural disasters, environmental factors, and other emergencies. The Philippines, being an archipelago located in the Pacific Ring of Fire and the typhoon belt, faces frequent natural disasters such as typhoons, earthquakes, volcanic eruptions, and floods. And as a result, health-related hazard mitigation is critical for the country. Health is a little special because health can become the after effect of a disaster, but health, like COVID, can also be the reason for another disaster. So it's like a double-edged sword to talk about health as an effect or as a cause of a disaster. Our country is composed of 7,641 islands that together cover a land area of approximately 300,000 square kilometers. It ranks as the fifth largest island nation globally, and our 11 biggest of the 7,000 make up 95% of the country's total land mass. The largest island is Luzon at the north, covering an area of about 105,000 square kilometers, followed by Mindanao in the south, which has an area of roughly 95,000 square kilometers. Our island chain is situated sorry about that, about 800 kilometers or 500 miles away from mainland Asia, positioned between Taiwan and Borneo. Sorry, that's a patient. Health-related hazards refer to elements, agents, or factors that can potentially cause harm to individuals' physical or mental health. These hazards can be present in various environments, including homes, workplaces, recreational areas, or communities. So some examples of these are chemical hazards, that are derived from chemical substances that may be toxic or harmful when ingested, inhaled, or contacted. So these are the things that are manufactured and produced in large quantities: solvents, pesticides, heavy metals, asbestos, airborne contaminants. There are also biological hazards that are caused by organisms or products from organisms that can induce a negative health response. Of course, the very famous COVID-19, which is a virus. There are bacteria, there are fungi, parasites, and allergens. Depending on the epidemiology in your country, you will have certain preponderance of some of these biological hazards. There are ergonomic hazards that relate to the workplace conditions and the body positions or actions that may harm bodily structures, such as repetitive movements, poor workstation setups for people who work with computers the whole day, frequent heavy lifting, poor posture, or prolonged sedentary work. There are psychosocial hazards that relate to the work the way work is designed, organized, and managed, as well as the economic and social context of work, such as workplace stress, harassment or bullying, violence, work-life imbalance, and job insecurity. There are safety hazards that are unsafe conditions or behaviors that may lead to accidents or immediate harm, such as sharp objects, falling objects, unprotected machinery or electrical equipment, improperly stored or handled materials. Environmental hazards are those that are natural or man-made that have negative impact on health, just as has been mentioned by Chai, air pollution, water contamination, poor sanitation, and natural disasters like the one in Maui. Mitigation in the Philippines, I think some of them we can control, some of them we cannot. The geographic vulnerability, of course, is just a fact of life. This is something that the Filipinos have accepted, and we try our best to mitigate some of these. But the Philippines location makes it vulnerable to numerous natural disasters. So every year we just know that we will have typhoons. And sometimes it's the bad side to it is that we take it for granted until we get hit hard by a very strong typhoon. But the good thing is that there are governance mechanisms to mitigate this. So we have the National Disaster Risk Reduction and Management Council. It is the agency responsible for ensuring the protection and welfare of the people during disasters and emergencies. They coordinate efforts between government agencies, NGOs, and other entities in areas like evacuation, relief distribution, and health services. Of course, the Department of Health, we call that these are ministries in other countries. They have protocols for health emergency response, addressing both immediate concerns like injury treatment and disease prevention, and longer term issues like mental health support and rehabilitation. They also conduct regular training and awareness campaigns to prepare communities and healthcare facilities. Give me a minute for this call. This might be a patient.
Okay.
Thank you. For water and sanitation, of course, this is a major concern in the country, and we have a lot of waterborne diseases like dengue and leptospirosis, and these are the things that are bothering us doctors in the hospitals when we suddenly get overwhelmed with this number of cases. Luckily, there are attempts of government and civil society to address this. But of course, these are always seasonal, and sometimes the preparations are not enough. Our healthcare infrastructure is underdeveloped. We still think there are opportunities for improving it. In hazard-prone areas, we want to have an emphasis on building resilient healthcare facilities that can withstand natural disasters and continue to operate in their aftermath. During Typhoon Yolanda or Haiyan, the last remaining structure was the hospital, and it was really a lifesaver for many of the people in Tacloban. There should also be community-based programs. I think we cannot really do much about disasters if we are located far away from them, and the community-based programs are the ones that are really very effective, recognizing that local communities are always the first responders in most disasters. There should be numerous community-based disaster preparedness and risk reduction programs. And these programs educate communities about potential health risks and empower them with knowledge and tools to mitigate these risks. An example of this is Project RAIN. Dr. Fran's teams working on this. I'm very impressed when I saw their booth in one of the meetings that I attended. They basically create an infrastructure and also local capacity to maintain a local network for the communication of the community. I think partnerships with international organizations like APAN, UNICEF, WHO are very important. We need to continue collaborating with you, and we need to extend partnerships with other organizations. because when disaster strikes, usually a single organization is unable to manage everything. They need the help of other institutions. So in Haiyan, one of those examples is the Department of Social Welfare and Development reaching out to Sahana, the team that created the software in Sri Lanka for disaster relief, and I think that really helped a lot during that period. Climate change and health, with the increasing impact of climate change, there's growing awareness about its potential health impacts, especially in terms of vector-borne diseases, health-related illnesses, and food and water security. Heat-related food illnesses and food and water security. So there are researchers that are doing geographic information systems. I visited ASTI a week ago, and I think there are a lot of materials there. And if we combine layers of health data from the health sector and the mappings from the Philippine Space Agency and ASTI, I think we can generate new insights about our vulnerabilities and be able to address these problems before they become unmanageable. Just as a plug, I'm also part of the Asia Open RAN Academy or Radio Access Network, and we'd like to build capacity on Open RAN, make sure that we have the right experts and people that can understand what are the features of this open network and whether it has potential to help out during disasters. My last two slides is about my network, the Asia eHealth Information Network. We were created by the World Health Organization in 2011 to help Asian countries with their digital health development. We started with 7 people from 6 countries, and now we have more than 1,000. We'll be happy to work together with APAN. In our group, we have 2 big groups. One is called the Regional Enterprise Architecture Council for Health, looking at the architectural aspects of digital health and interoperability during non-disaster times. So these are electronic medical records, electronic claim systems. And on the other side are the COIL, or the Community of Interoperability Labs, that are creating data pipelines to each other to make sure that when another pandemic hits, like COVID-19, we would have the trust network that is a prerequisite before real data sharing can happen in a pandemic period. In summary, the Philippines, by virtue of our location, is exposed to several environmental risks. The strategy for mitigating health risks in the Philippines requires comprehensive approach that integrates local, national, and global initiatives. And this strategy aims to protect the well-being of our population, particularly in the light of the country's vulnerability to frequent natural calamities and shifting climate conditions. Again, apologies for the call during my presentation. Thank you.
Thank you so much, Dr. Marcelo. It's really helpful to to know that so many things has been conducted in Philippines. I think that's very, very, very useful for this working group. Any comment or question to our speaker? Any comment from the room?
I have one from
Yes, please.
here in Sri Lanka. When you say that you get through all those disasters when in the current situation, if something happened like in a week or so, then the process and everything improving much better, I believe. You think it's gonna still be struggling during the disaster time to deploy or help people? That's my question.
Yes, thank you for the question, Chai. I think there will still be problems, but I think we are improving. Every time I listen to the news, we now hear about the local government disaster officer coming on the radio and telling us about the preparations they've made before the typhoon strikes. I think to me that is a very important progress, that there is an accountable person in the local government unit that actually has the answer to the question of how prepared are you for the upcoming disaster. Having said that, unfortunately, after the disaster, we still have areas in the Philippines where there are landslides and people are still in the landslide prone areas, and they were not evacuated. And the disaster officer will say, we warned them that they are in a landslide prone area, but they refuse to leave. um I think the governance is an important part of the problem, of the solution to the problem, but also civil society action after the governance has made this very clear evacuation instructions. I hope to learn from the other countries. I know in Japan, they have this mechanism of warning people about an upcoming disaster, and it works for them. So I'll be happy to hear the experiences of other countries on how to prepare communities for a typhoon that's going to strike them soon. Thank you.
Thank you.
Thank you. Any other comment?
Yeah, hi, Doc Eloy. Thank you again for your time, for your gracing us in this event. I'm particularly interested in the community of interoperability labs, or COIL. So what's the update about that initiative? Can you tell us more about it? Thank you.
Thank you. Thank you for the
More about it.
question.
Thank you.
So way back in 2015, in our network, we identified our core problem as the lack of interoperability, even within the different programs of the same Ministry of Health. So we thought about looking for solutions about how to solve this interoperability problem, and we looked at international standards like HL7, SNOMED, and we trained ourselves. We got funding from WHO to get trained in the standards. And when we got trained in the standards, we said we will be interoperable in the next year. And we realized we can't be until we are all trained in enterprise architecture. So we requested funding for training on enterprise architecture. But after the training, it was not enough. We realized we need to have training on IT governance. So finally, we all put it together as you need to have governance first, and the governance will require a blueprint that is shared amongst all stakeholders, and then we need to have the standards as the building blocks. So the community of interoperability labs, we have 8 countries, Doc France, Philippines, Thailand, Malaysia, Indonesia, Laos, Cambodia, Sri Lanka, and Bhutan. And they're emerging. We're still helping each other find out how to get into this interoperability solution. But what we realize is that interoperability does not happen if people do not talk to each other. So even if you say you're interoperable and I say I'm interoperable, but we're not talking to each other, we don't think the data will flow, because I don't know who is Dr. Franz and you don't know who is Dr. Alvin. And because of that, not because we don't know each other, there is no trust, and there will not be data exchange, even if our data formats are standardized and interoperable. So I think trust is very important. I really like the theme of the DMWG, because you want to establish networks and trust among each other, because I think that's the key to disaster mitigation. Trusted
Yes,
networks.
in the end, it's still human network. Thank you, Doc Eloy.
Correct. Yes. Thank you.
Thank you. It's the same problem with the other working group, open and sharing. People not talking to each other. It doesn't matter. It's gonna be the problem. So the first thing that I think that we need to change is the culture or people mindset to help each other. But that difficult and take long time. But we patiently doing it, still. Okay, thank you.
Yeah,
Thank
thank you
you.
so much. Yeah. I think the discussion is very, very useful. especially for those issues such as the interoperability, the trust framework. And as Dr. Marcelo mentioned, the Asia e-health information network and other collaboration already there will be also a good reference as the basis for the collaboration in the future. They are also very good. Yeah. Any other comment or question to our speaker? So today for the health-related topic, we have two presentations. Apart from Dr. Marcelo, we have the next speaker, Dr. Sato-san from Tohoku Medical and Pharmaceutical University in Japan. So Sato-san, we can see you now. Would you please share your slides?
Okay.
Yeah, we can hear you clearly. Thank you.
Can you see my slides?
We can, yes, we can see your slides now. Yeah, the floor is
Okay.
yours. Thank you.
Well, at first, I'm very glad to be here, even if I'm not in Sri Lanka. And thank Eric for his much effort to manage the working group. Thank you. And well, I'm interested in disaster relief activities in private sector. For example, disaster volunteers, and how to support them with ICT tools and information networks, so-called disaster information support. Today, I will introduce some contact points between disaster information support and healthcare issues. At first, let me introduce the emergency response system in Japan. We have three pillars of disaster response: public support, mutual support, and self-support. Public support is, for example, restoring infrastructures, subsidy payments, or medical services, and so on. The mutual support is this is the private sector of disaster relief activities. And self-support is affected people, the action of affected people themselves. This is its introduction. This mutual support, including the disaster volunteers. The private disaster relief activities were done by disaster relief NPOs and individual disaster volunteers. And a system of named disaster volunteer centers manage their activities. And they play a very important role in disaster relief activities in Japan. And its details I will talk in the second half of this session. On the other hand, in the case of COVID-19, well, this pandemic situation is a kind of disaster in the meaning of the livelihood of residents is threatened. And in this case, public support is crucial. It means hospital or public health centers and emergency services. And local governments manage the infected people. Well, on the other hand, private disaster relief is hardly help patients directly because of the patient isolation. So in the first half of my talk, I will introduce this story. Well, against COVID-19 pandemic, Japanese government takes this operation that they want to reduce the chance of infection to protect the especially the elderly and vulnerable people, and to realize it that avoiding gathering or vaccination, universal masking, hand washing, and so on is important. So Japanese government want to let people know correct information and infection trends. On the other hand, local governments in Japan are preoccupied with infected person management. So there are very few people, few staff for public relations. And private supporters hardly help patients directly because of their isolation, or it is very sensitive information of infection. In the situation, civic group Code for Japan collaborated with Tokyo Metropolitan Government, and they developed COVID-19 information sites together. This is the Tokyo Metropolitan Government's COVID-19 information site. And there are many information panels like that. Some shows the infection trends, or number of deaths, number of beds ready for the patients, and so on. And this is the impact of this site. Big impact made by the first line. They made the source code public. So other civic takers and local governments opened many of the clone of Tokyo sites. There was 52 clone sites in total in 47 prefectures in Japan, and at least 8 of them official prefectural sites, not only by volunteer. Also, I and my colleague developed an official clone site for Miyagi Prefecture where we live. I like that. Left one is the old site, original site, and we changed the site as right side. Oh, this information and online publications are very effective in Japan. For example, people's for example, the decreasing in going out during outbreaks. And civic tech engineers support the local governments. And then this, the first one, Tokyo COVID-19 information site. This is the first case in Japan to collaborate between civic tech engineers and local government. And because of the source codes are opened, many local governments are supported by civic tech engineers, officially or unofficially. In addition, the group Code for Japan is civic tech engineers group founded in 2013, and the founding engineers experienced support activities after the Great East Japan earthquake. So the start point of the Code for Japan is disaster. Well, let me go to the after half. Social welfare councils. Well, we have three pillars for disaster response, and public support is preparing shelters, recovering infrastructures, paying subsidy, and search and rescue or medical treatment is also included in public support. For example, emergency medicine, they have the online data sharing system like that. It's named as Emergency Medical Information System for monitoring status of hospitals and activities of DMAT, disaster medical assistance teams. Or also, condition of emergency shelters monitored to prevent environmental disease. On the other hand, in mutual support, disaster volunteers are working for affected residents to removing debris and cleaning houses, emergency repair of houses, or various life supports. And then this is I think this is the contact point to healthcare issues. Improving the living environment should reduce the health problems of residents. But anyway, disaster volunteers play important roles in the Japanese disaster response system as a mutual support. Let me introduce some theme of their work. They are removing mud under the floor or around the houses. And some of these volunteers used heavy machines to remove debris or mud. And there are some volunteers with skills, technical volunteers. They can repair the roof of houses. And there are many individual volunteers come from all over Japan, and they are managed by disaster volunteer centers. And the disaster volunteer centers are prepared by social welfare councils in affected area and with disaster supporting NPOs. This is here is disaster volunteer center, and they collect support needs from affected people, residents. On the other hand, they call for help to individual volunteers and matching and send them to the site volunteer works. After the working for the day, they report the result of the working finished or unfinished. So if there are remaining works, they should send other volunteers in another day. Well, this social welfare councils who are managing volunteers or disaster volunteer centers. Social welfare councils are settled in each municipality in Japan and each prefecture or city, town, or village. And they are serving home visit nursing and various life supports in normal time. Most of social welfare councils doesn't have data management systems like databases. So they are managing data with spreadsheets or maybe a paper. And in disaster time, they are operating the disaster volunteer center. So they had to manage support needs, progression of works, and many volunteers. Well, social welfare councils have overcome this kind of hard work in disaster time with under cooperation of NPOs. But nowadays, weather disasters like heavy rains are getting stronger and more frequent in Japan. So this legacy system looks reaching its limits. So nowadays, some social welfare councils have decided to install data management system for disaster volunteer centers. For example, Kintone, it is a product of Japanese company Cyborg. This is the most famous, I think. This is the window of the Kintone application. Based on the activity reports from the volunteer workers, the point of support needs are plotted on the map, and the color is for the status. Status means not started or working, done, or cancelled. And another window, this is for volunteer workers management. In each individual volunteer registering their name or mail address and which day they can come to the site. So, for example, the disaster volunteer centers can see that can get the graph of the histogram of daily workers, the daily numbers for volunteer workers. Well, with this kind of data management system, the disaster volunteer centers are easy to grasp overall picture of support needs. And so disaster support activity getting more efficient. It means more accurate supplying, faster recovery of living environments, or better mental support. Sorry. So this kind of ICT support activity for volunteers might affect to the residents or affected people's health. In addition, I mean, social welfare councils, once they get this kind of system, they tend to keep using after disaster situations are formed. Well, now, 20 prefectures in 47 in Japan are now using the data management system. So their usual work, like home visit nursing and life support, should be better with the data management system. Well, this is a summary of the second part. Disaster volunteer centers are now getting data management systems, and it is better. It makes better support for affected residents, and the system is also used by social welfare council after disaster. So, disaster could change the quality of living support by social welfare center, social welfare council. Let me conclude my talk. This is this is the continuum of status of residents, health people to in the risk of life. In COVID-19 pandemics, health people could get behavioral restrictions by spread of infection, and if they exposed to viruses, they might be infected, and so. And the ICT engineers like Code for Japan can help to transmit information, and this helps. This could might stop the spread of infection, or might decrease the virus exposure. And this is in case of a disaster. Well, in the disaster acute phase, many injured people come to hospital. It is the target of emergency medicine. On the other hand, in the chronic phase of disaster, slowly it affects for health of residents. Even though health people, once they got urgent payment or loss of income, they might be frail in economical meaning. And a change of living environment, like lost their houses or and so on, they could be frail in physically frail. And affected people tends to lost their chance opportunities to exercise, walking, or take a walk, or go to shopping, and so on. So it might make some physical disabilities. And in this situation, the disaster volunteers, they are non-medical people. Non-medical volunteers can help this kind of environment to help to return repairing their house and the some kind of various living supports. So I introduced two cases, and these are same in this point. ICT support activities in emergency situation. And the ICT support focus on the organization that support citizens. I mean, local governments in the pandemic and disaster volunteer centers in other disaster. So in both cases, non-medicals could indirectly contribute to the healthcare issues. Well, disaster relief activities in the private sector are getting closer to health support in nowadays, I think. This is all of my talk. Thank you.
Thank you so much, Sato-san, for the case sharing in Japan about the health related cases. Yes.
Locomotives and his buckaroos, released in 1967.
Okay. Any comment or question to Sato-san? As a working group here, and also as you can imagine, we are a bit academic, so most of the we are not possible to involve directly to the mitigation or to the emergency operation things when there's any hazard happened. But through those analysis to the case study or requirements of the cases events before, we can try to identify the bottleneck, the gaps, and also the barriers, how to improve the responses to those emergencies. For example, as Sato-san mentioned, the supporting systems, some of the training, the management of the needs, the volunteers, and etc. should be prepared during the normal time. Yeah. The training and also those information sharing infrastructure, etc. should be prepared beforehand. Should be prepared for the next event. Yeah. So those things are very, very helpful. And also similar things mentioned by Dr. Marcelo as well. So in this working group, we are serving as a open collaboration platform, as we discussed earlier, together with the Sri Lanka National Science Foundation. So you are all very welcome to bring your cases, your needs, or your problems to the working group. So we can looking for experts. We have experts from almost every APAN partners from different fields, different disciplines to work together for the case study. So through the process of the case study conduction, and then we can share those experiences or the outcomes, all the materials to all the partners. That's the approach we are doing, and for the hazard risk analysis. Yeah, this is the first time we like to learn about the health related cases. Yeah, it's just a beginning. Thanks a lot for the expert from Philippines and also from Japan. They share their really practical experiences in the past few years, and also deliver those information about what's going on in the regional collaborations for the information sharing, how to overcome the interoperability and trust issues. Yeah. Any other comment or question? If not, or maybe we can still have some time in the second session for discussion. You can also think about if there's anything you'd like to raise later on. So let's move on to the last speaker in this session. That's Dr. Chai. Yeah.
Okay. Just one. All I can try to share through this. Okay, let's see. Shares online then to this. Yeah. Okay. Just share from here. Yeah. Okay. Just the update quickly before we go to lunch. This is about the, sorry, wearing my glasses, Wi-Fi and smoke related activity that have been doing in the Upper ASEAN. Let's just say that. So it just gonna go through it quickly, just the current situation. And now I just heard that in Indonesia, there's a lot of smokes down in Jakarta, and then it started. We expect to have a very bad fire season next year, and then the smoke as well, because of the coming of the El Nino. We just get into the El Nino in full El Nino, I think like a month ago, or in last May. So this is just it's not moving. Okay, slowly. This is all the database that I usually use and monitor, and working closely with the ECMWF, CAM, Copernicus, Copernicus Atmospherics Monitoring Service, that they have the system, and then Mark Pellington helping a lot in the past 5-6 years. So every year he will make this. So every year, slow, yeah, he will make this to see that carbon emission in our Upper ASEAN region, how much, and then using the satellite to calculate the carbon emission from fire. He doing the map for each month. Already moved, but slowly. Each month for in the past since I think 2018 up to now. So this is just to see that this year, the fire season up in the Upper ASEAN usually from January to April. Okay, and now moving down to South ASEAN, Indonesia, Malaysia, and southern Thailand. And now I look at the system from NASA firm that we support each other for a long time. It's spreading, it's spreading like a lot in Indonesia now. So this is just to get the idea that this year you can see that in March for Laos, the emission a lot, and usually we have a lot in Cambodia early in January, but this year is not. Okay, so this is just the number, okay, that we calculate from the satellite, and this is from the global fire assimilation system that ECMWF pay for it, so we can use the data for free, and Mark do this for everyday emission in each country or whatever boundary. Okay, I have the code, but to write it like again and again, if not, they can do it automatically, which is easier, and then send the map, the graph at the end of the month, each month, to see the different activities. And the data run back like 20 years, but off of the satellite. You can use it for free, so that's a good thing. And then he kindly doing for every country in Upper ASEAN, and but his the duty of this, they follow the fire globally. Like if there's a lot in Canada, this guy Canadian guy, he will look closely to Canada or lately Spain, like moving Hawaii. He will make the graph, the map, and to show the emission, and we can use this like I said again, for free and openly. You can download if you want to study, because it's a 41, I think, emission that you can download it from the database. And the main database in the world is in Europe, ECMWF, and in NASA, it's but produced by Guido Waldewolf, which is a Netherlands researcher but working for NASA. But it's just the idea to see that Myanmar and Laos. So you see the Thailand also, you can look. In Thailand, we do it every month separately. So you can tell that in January, when comparing 20 years back, is people complain a lot, but actually it's not that really bad comparing with the historical data. But probably because of the phone, the access to the low-cost sensor, the IoT things, making worse. So people, they get information quickly and fast, and they not realize that actually before is worse than current. But next year, it will. But you can look for Thailand this year. It's going up a lot comparing with last year, because this year is the beginning of El Nino. Last year is La Nina. People try to light the fire, ignite the fire, but it's not spread. I ask, but this year spread a little bit. But next year, you look at Hawaii. When happened, the fire happened, it moved very quickly, and then the land use activity, land use and cover chain will play a lot. Okay, we play a lot of influence of this. And in case of Hawaii, the called typhoon. Yeah, what is it? What the name of typhoon? Lina or something. Yeah, further away, 300,400 kilometers away from Hawaii, but it affects Hawaii wind. Go up to 100 kilometers per hour. So when the fire get caught, and it's moved very quickly, and unfortunately, the town that we saw in the news is the old town, all the house building by wood, 250, 300 years old. So it gone quickly, and now found out that many people die on the street in the car, which is so the fire moving very fast, and will be in. Next year will be bad. Already prepare. This is just the total. already prepared for Indonesia in last May. Yeah, last May they started to prepare for next year because of the Met Department for Indonesia, BMKG, already warning the government that it's going to be dry in Indonesia. So the southern Thailand also will be dry. So we also now currently every day, if in the past 2 weeks, that the peat fire already started in southern Thailand, but not that bad. This year, not that bad. It will be bad next year. So the water table going down like 10 centimeter. So it's okay. But another month, okay? Like what happened in Canada is unusually dry, and the heat wave, the jet stream, not moving, it's stuck. So the heat wave stay there, and then somebody just light something, or they have lightning also. It spread really quickly. But the fire in Canada, if happened by lightning, they will not suppress. They just control and let it go, let it take its course, because that's the nature. But the problem is that people also ignite the fire, let's say 50-50 now. The chance that in case of Hawaii, 98% that people lighting the fire. In case of our region like ASEAN, 100% people causing it. And it's not, if it's dry, the weather dry like next year, the El Nino, it's not going to be easy to control, okay? It will spread quickly and the intensity will be very high. So this slide will be up in the website anyway. So you can look at this graph, the number, just to show that actually it's not that bad as it look, or we saw in the news, just the intensity that higher than usual. And they have a new term, mega fires, which will be, and the urban interface, because people living close to the tree, to the forest. And like California, very lucky this year is that they got the big hurricane or something going in the south. But they can mobilize the forces like firefighter to help Canada, because their fire season started a little bit late. So Canada got help from 12, 13 countries going and help them, because they have different policy. Also the management that they don't expect to have this big fire. They think it's not going to be that big. So they didn't prepare that well. They just cut the budget, blah, blah, blah. But now they will change. Okay, this is just to show again. This the same in Upper ASEAN. The summer, March, will be the most forest fire happen in Thailand. And the land use that ESA doing, this is using based on the system that FAO using. So we not doing it. I just put a request, and then a guy at where is it? Rome, FAO Rome will do it. Alfonso, his name is Alfonso, but he will adding the data, and we can use the online tool. Everything based on the need to. Yes.
Why the 2022 is so small?
Because of La Nina. La Nina next year will be like this, I think. Go up. Should be next year, should be close to 2000. NOAA, I didn't look yet. NOAA just sent the robot, the boat, to measure at the Pacific Ocean in the center and go down 1 kilometer to monitor the real-time temperature. But I just saw, don't have time to look that the data come in or not to really see, because this time is bigger than 1997 and 98. So that's why we expect to have bad at all, but the burn area. So also the activity that the the International Wildland Fire Conference every 4 years. They have last time in Portugal, and then as we work with NASA for a long time, since I don't know, since they're not in NASA yet, they're in University of Maryland to set up the system. It's at the beginning we have fire mapper for Thailand fire mapper, but now everything moved to NASA and change it to this fire or resource management system that everybody using. All the satellite data, the product will be in here regarding active fire. So, and they want to see the case that the has been used to the people. And I try to tell them that we are trying to push to the citizen science because Thailand has a lot of application, anything. NASA, they cannot do application, they're not that good. But we in Thailand, we built a lot of application according to their data. So has been in a good use. So everybody doing that. And Chris Elwich used to be a chair working group for Earth monitoring in APAN, but he moved out from NOAA to my school, University of Mine, Colorado. This is they're doing the mining, one of the best in the world for the. But he, as Savage, he moved the thing that he done in NOAA to this school. So he's doing the monitoring is a night fire monitoring, which is the intention to detect underground fire, the underground fire. But the name actually is called ground fire. To try to detect that at night by using, he's the expert in the night light of the world with the DMSPOLS, the Air Force, the U.S. Air Force satellite, and developed into VIR. So he also helping us to get additional data than what NASA producing. So moreover, and then this is the project, but there's another, I don't know, this is the project, Asia Connect project that having for the IoT, getting the low-cost sensor around. So this is AIT project, okay, AI based in AIT Interlab project. I help them to identify where to put the sensor to see the movement of the smoke. So there's a system called Southeast Asia HEMONS, and the sensor, the air quality sensor is a patent to, I don't know the university, but one university in France that they make this. So a bit of good quality. So they got the funding from Asia Connect and doing it. So just to show a bit that they doing in Laos at the Luang Prabang at the VNT, and to put the sensor on the same day, there's a tool that you can compare and see the different air quality. In this case, it's a PM 2.5. You can see it's in Chiang Mai. It's not in a sense, it's not that bad, but people are living there a lot, so a lot of complaint. Luang Prabang is not that bad, but Chiang Rai really go up, but they don't have many active fire when the satellite go over. So, but this is from the field, okay, just to show that it can be. So we're trying to do something else that the test in the field, also using when you do the real burn, but we have to collect the data. This is the Faculty of Forestry, because it's a university, and try to collect data and see how the prescribed burning can be affect to the soils, to blah, 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 and see. And lucky we can do that because of the equipment. That equipment is a fire weather equipment that we asked the Royal Forest Department to borrow from Canada, but our intention is we're not going to return it, something like that. But it's having a very good, the high grade of all the sensor. It's like yeah, so it can be moved quickly. So that, and currently this fire weather data, we can calibrate the fire danger rating system in the Upper ASEAN and ASEAN using the system from Canada. But we find, because of that equipment I installed, I found out that what we have using satellite data to calibrate the threshold to use for the system for Upper ASEAN and Thailand are wrong in 2 years ago. So now I'm asking Canadian Forest Service and Natasha Chacko and then Mike Wharton. Mike Wharton is like #1 guy about this for Canada to recalibrate for us. So make the number better. So it help the system will help support fire management in the country daily. And we also have try to do this early warning system. So the forecast will be like 6 days using data from Hydroinformatics Institute, the forecast for the weather. So we have like a bit future 6 days of the condition of the field on the ground. So at least we have the idea: is it going to be dry? Is it going to be not that dry? Okay. Moreover, after that, we also working this France embassy, and they're helping Indonesia, and we were in the webinar together. And then he asked how his president would like to expand it to Upper ASEAN. He said, okay. I said, I put them together with AFOCO because AFOCO also a Korean organization that doing the forest thing, anything forest related, do together so we can bring more participants. And so we done it in Thailand because the main facility is in Myanmar, but because of unstable condition, I said, you can take the participant, but can you guarantee that they can come out? The Korean, they cannot guarantee that. So I said, better do it in Thailand first and see in next year, if the situation in Myanmar improves, we can go back to the very fancy facility. They pay like 40 million US to build that. Really good. It's just like, this is Korean here, just there, like 1 hour from Rangoon. So yeah, and then this is like the first time that doing the ground suppression, and participants don't need to speak English first time. So it's kind of fun to really do it because they can use Google translation and communicate. Like this guy always have to look in his hand. Well, he just like using the phone all the time. He cannot speak. From Kazakhstan, Kyrgyzstan, Mongolia, they cannot speak Thai most of the time, because if not, the problem is that the people from the office will attend. The people that work in the field will not be able to attend. That's what my observation. So I request to take this good English, or have to be very good English to participate international training. So we test it out. Even the French trainer, their English is not that good and very difficult to understand. The French, wow, really. Yeah, and then this is another system. When I finish this, we have done from APAN 56 or 55 in Nepal, and son of my friend working for ECMOS, was mentioned yesterday. So they have the data very slow data, because NASA got the restriction. NASA not own the satellite. They just send it up. The management is NOAA, and the guy Winfred Schroeder is the one who wrote all the code. So I said, okay. I asked him to do it for ASEAN already. It's going to be as fast as ground receiving station, and we decided to add it for Nepal, and now Nepal has it. Okay, and that's it. It's not much. It's like this may be on the second. We will discuss about this in the second session. That the Laurent Kazan, this guy, good friend of mine, he just organized big workshop, like 2 weeks workshop in UNSCAP in Bangkok. So I said, when we gonna have APAN 57, I would like him to support and help us, like masterclass or workshop in Thailand. So now he already put the schedule. This is another one for AFOCO. That's Ban Sung Ju and Ju Hong Moon. Yeah, it's another one, but the same that this is related to forest fire early. I hooked them together because they would like to have the system. So anyway, another that wrap up and okay. This one for that we have to discuss that the GISDA okay, JAXA okay, and the UN Spider okay. And UN Spider are good thing that they can support the participant, but we will have to discuss about that in the second session. Thank you very much.
Thank you so much, Chai. You already mentioned about what we are going to discuss in the second session. Any quick question to Chai, to our speaker in the first session? In fact, the health-related cases that's mentioned in APAN 55 in Nepal by a participant to the working group meetings. I mean, this model is quite helpful for the regional collaborations. So, as I mentioned, you are very welcome to bring your use case, your requirements to the working group. Yeah.